Researchers are learning how much COVID-19 can impact the brain. Medical reporter Liz Bonus takes us inside the procedure room with one of the top neurosurgeons in the country to explain what they've learned.
We have certainly learned a lot about the brain this pandemic year, according to neurosurgeons, especially about potential risk from the virus and what's commonly called COVID brain. Inside this delicate procedure, Dr. Andy Ringer is performing an intervention in the brain to reduce pressure,
causing chronic, severe, disabling headaches and things of that nature.
This problem not unique to COVID-19, but for months in this pandemic, Dr. Ringer's team at Ohio's Mayfield Brain and Spine and the TriHealth Neuroscience Institute has been following what do appear to be COVID-related brain problems. At first, they learned when stroke rates drop,
people were avoiding coming to the hospital out of fear of exposure, and as a result, were not seeking care for their strokes when they needed to.
While stroke treatment now is back in demand, here's what they're learning about the brain and vascular system in patients who've had COVID-19.
There's a very complicated story here. It may be that those patients that have the more severe response to COVID are at greater risk for spontaneously forming blood clots that can result in heart attacks and strokes.
Dr. Ringer says he's also familiar with a term many people say they feel after recovery from the virus called COVID brain. It's sort of described as a brain fog feeling. There's some thought it's connected to tiny blood clots that form in the brain or the deprivation of oxygen in some patients.
We recognize that the starvation of the brain from oxygen for any significant period of time can be a life-threatening or altering event.
It's also not surprising, Dr. Ringer says, that some people report feeling better with this symptom after getting the COVID-19 vaccine.
The vaccine is like a short-term exposure to the virus itself. So for many people, the second exposure tends to cause a big reaction. If you've had COVID, that might be your first shot. If you haven't, it would be the second shot in those that require to.
Now, since you do know your own body best, researchers say follow up if you do notice weakness on one side, which could be an indicator of a stroke, fogginess in your brain or head or anything else, and follow up with a medical provider that knows your medical history. I'm medical reporter Liz Bonus. We'll throw it back to you.